My name is Dr. Chinedu Michael Dike. I'm a family medicine resident doctor at Niger Foundation Hospital in Enugu, southeastern Nigeria. I was a recipient of the 2018 Merck Foundation Diabetes Award, which enabled me to complete a postgraduate diploma in diabetes from the University of South Wales, and afterwards a Master of Science in Diabetes from the same institution. Now, shortly after completing my postgraduate diploma in diabetes, I started the annual World Diabetes Day celebration in my hospital, Niger Foundation Hospital in Enugu, southeastern Nigeria. This annual event features diabetes-related health education, as well as free medical screening, blood glucose measurements, blood pressure measurements. So we've been able to take care or attend to hundreds of people over the past 4 years. Okay. Also, I've been able to mobilize other healthcare workers, pharmacists, nurses to collaborate in this good initiative. And from our experience, we've been able to make early diagnosis of diabetes in people who are not aware about the condition. Also offered advice to those who are poorly controlled on their medications for diabetes, for those who are already known to be diabetics. And people have benefited well, and they're very happy. The 4th edition, thankfully, which was a few months ago last year, we were able to take this initiative to a rural community about 40 kilometers from where our hospital is, and those in the community were very happy with us, and they were grateful for what they were able to learn, and they were able to know, and we were able to empower them so that they have more ability to take care of their condition. So we give them the power to self-manage their condition, of course knowing when to present at the hospital for the regular checks as and at when due. My Master of Science dissertation was on the current trends in the management of diabetes in Africa, a systematic review. So diabetes is a condition in which obesity and type 2 diabetes occur at the same time in the same individual. So we looked at the current trend of therapeutic options for managing this condition in Africa over a 10-year period between 2011 and 2021. And then, of course, the management plan is in 3 main categories. There's the lifestyle modification through exercise, diet, avoiding smoking, reduction in alcohol consumption. And then there's also the plan of using pharmacological methods, that's medications, which include tablets or pills, and injectables like insulin. And then the third option is using bariatric surgery, which is the surgical intervention. So looking at this data we had studies from different parts of the sub-Saharan Africa, West Africa, Central Africa, East Africa, and Southern Africa. So we noticed that lifestyle modifications were found to be safe and cost-effective in Africa. Now, looking at pharmacological methods, we noticed that while there are medications available in Africa, but the newer agents for tackling diabetes are not widely distributed in Africa because there's an uneven distribution of resources in Africa, with places having enough resources and many places with very little resources available. So this calls for stakeholders, to come in and invest in diabetes care. Now, as regards to surgical interventions through bariatric surgery, not too many centers do this surgery in Africa. It's not so widely available. So again, there's need for empowerment of the healthcare system in Africa, so that these methods, the pharmacological methods, and also bariatric surgery is more widely available for those who need it, so I can improve the quality of care of Africans living with this condition. Shortly after I completed my master's dissertation and finished my MSc program, I applied for membership with the European Association for the Study of Diabetes, EASD, and then I was granted membership, and membership fees were waived for me because they considered my achievements with diabetes. Of course, Merck played a good foundation, Merck played a good role in helping me to achieve the fees I've achieved in the past few years. And so I was offered membership with the EASD, and I'm really grateful to Merck Foundation for that. Now, after that membership offer, I eventually submitted my dissertation, the abstract of the dissertation, for the conference of the IDF, which is the International Diabetes Federation, and it was accepted. And it was for the conference as a poster presentation, which took place a few months ago in December 2023. Eventually, the abstract will be published in the official IDF journal, okay, Diabetes Research and Clinical Practice. Now, Merck Foundation is also really interested in improving the quality of health and, of course, quality of life of people in Africa. And with regards to diabetes, they have various things on diabetes. For example, they have a song about diabetes. They also have cartoons and other visuals that talk about diabetes and how to prevent it, how to manage it, and also how to be aware of the risk factors for diabetes. So Merck is committed to improving the quality of healthcare of Africans, and I'm really grateful to what they've done, how they've helped me to achieve my dream of becoming a diabetologist. And so I encourage all those who are embarking on a similar program like me, sponsored by Merck Foundation, to take their program seriously. Eventually, we'll work towards making Africa and the world a better place for everyone. Thank you.